Good afternoon, everyone. My name is Miguel Vieyra, and I'm very pleased to be here representing the Children's Bureau in our efforts to implement the National Youth in Transition Database, or NYTD. As many of you know, NYTD is a new reporting system at the Children's Bureau that collects case-level information on youth and the independent living services they receive, as well as collecting some outcomes information on youth who are in foster care and youth who have aged out of foster care. I don't have a formal presentation for you. I have a couple slides here, but I'm going to breeze through them. But I do have one big update, which is to announce that nationwide data collection for NYTD is underway, and that's a very exciting moment for our field. So I wanted to really congratulate states for all the hard work you all have done in the past few years to prepare for NYTD. It's been very satisfying to see all this come together, and I know that already states are beginning to survey youth in foster care at age 17, so it's all happening finally, and it's very exciting. The Children's Bureau is very excited about looking ahead to the spring when we get our first set of NYTD data in April and May, so we're eagerly awaiting that. I know the focus of this meeting has been on, part of the focus has been on exploring ways to work with youth and to improve permanency outcomes for youth, and I think it's very fitting just to at least briefly mention the role NYTD plays in this work and informing this very important work and developing some insights really for the first time on a national level into what services and practices are effective in preparing youth for transition to adulthood. So I think it's a particularly exciting time for the Bureau and again for the field to, as we launch this new effort to collect and use a new set of data to drive, we hope, program and practice improvements. I just wanted to put up a slide here to remind folks resources that you can access if you want more information about NYTD. We do have, in addition to, of course, the Children's Bureau website, we launched a few months ago a community practice site. I'm not sure if any of you have visited it yet, but we created this website as a resource for states to really support state conversations among your peers in terms of how to implement NYTD or lessons learned along the way, or if you want to share resources or events, we have a community calendar too. That's a resource available to you, and that's simply the website is simply nydcommunity.acf.hhs.gov. We also have a very active listserv, which I'm sure many of you are a part of. That's been our primary link between the federal NYTD team and states to kind of give you updates on where we are with NYTD implementation, as well as to provide the latest technical assistance resources as well. And of course, TA remains available to all states. We have our two TA partners, the National Resource Center for Youth Development. We have a few of those folks here, and also the National Resource Center for Child Welfare and Data Technology. But in addition to these resources, I do encourage you, if you're not already aware of what exactly is going on with your state in terms of implementing NYTD, I'd encourage you to ask. I know that we've been very pleased at the federal level to see some really innovative things states have done to really implement NYTD, to engage youth in this process, and to implement a survey, which has never been really done before. And I also am pleased that we've had a number of states who, before we even have data, have already started thinking about plans that they're putting in place to actually integrate this data into their own service planning and program evaluation efforts, establishing benchmarks. Very, very exciting stuff. So I encourage you to ask your state, if you don't know, ask what they're up to, because it's likely very exciting. And this will remain a TA focus for us throughout this year, this coming year, working alongside states to use and analyze NYTD data as we all improve our collective understanding of transitioning youth. That's pretty much all I have. Thank you.